people spend too much time together. Hey, we're here.
It's us.
We are live.
And then Bailey will check and make sure we're live on all the platforms, right? Hey, what's up, everybody?
What's up, everybody?
We are just getting going. We're
Yeah.
about 5 minutes late, 6 minutes late. Sorry.
Well,
But thanks for joining, all 0 of you. Hey, there's two people. It's all us.
It's Bailey.
It's
and
all
Daisy.
us.
It's all good. I like that.
So it's Friday.
It is.
We're not at work. Kind of at work.
Kind of at work. I'm in scrubs. You're in scrubs.
Well, we have to work today, actually.
Just for a second.
Yeah. So we're actually going to the office today. We usually don't work on marketing days.
Yeah.
But we're going to go to the office and deliver a bridge.
Yeah. I had to go in this morning and finish some notes.
That's right. You went in this morning.
Yeah, I did because we had
Did
to
you get
leave.
them all done?
Yeah, because we had to leave last night.
Why did we leave last night?
One of our wonderful, wonderful patients and her husband took us to dinner last night.
It was amazing.
As a thank you, and it was so delicious.
It was wonderful.
I had
Brazilian steakhouse.
I had dreams about it. That's
really
how good
good.
it was.
Yeah.
Yeah.
It was a lot of fun.
Really good. So yeah, I had to go. We had to leave a little quick yesterday to make sure we weren't late. So I had to go back to the office this morning and finish some notes and submit some records for a patient surgery that's in a few weeks.
Yeah, we got a lot going on. So I don't know if you noticed, brand new studio.
It's gorgeous in here.
Yeah, it's really
by the
nice.
way.
It's a little warm.
There's
I feel
not
like
a-
I'm under one of those food heaters.
There's not a way to like turn them around, but
Oh yeah, well,
It's
just
really
trust
nice
us. It's
in here.
super nice.
yeah. Really nice.
So I'm Dr. Emmett. We are a 3-on-6 office in Las Vegas. What's your name?
the 3-on-6.
Yeah,
office
sorry,
in
excuse me.
Las
We are the
Vegas.
3-on-6 office, and we happen to be in Las Vegas.
Yes.
What's your name?
My name is Tiffany. I'm Dr. Emmett's assistant.
Oh, I can't wait for you to
Did-
finish this sentence.
We have this conversation a lot. I have many job titles. Pick one.
There you go. Pick a title.
Implant coordinator, surgical assistant, treatment coordinator.
Sounds good.
Best friend.
Yeah,
Pick one.
pick one. So we go live and do these events every 2 weeks. Sometimes we bring on another doctor that does 3-on-6.
Yeah, you talked to Dr. Stanley last time.
That's a good event. We have some events coming up over the next few months with some other doctors that are going to be joining us. I think,
Anesthesia provider.
and yes, the anesthesia provider will
Yeah.
come on.
Yeah.
So basically, this is for you guys. It's for people who are considering 3-on-6,
Have
or
had 3-on-6.
maybe have had 3-on-6. Maybe you're in the middle of the process of 3-on-6. And what we do is just pick a topic every other week. We talk about it, and then we open up a live section so people can ask their questions, and we can answer them in live time.
We
So-
kind of decided on this topic because one, you were talking to Dr. Stanley. There was a lot of people that were very curious about what comes next after surgery. Ha, we can get closer.
I can't see. Oh, are we only showing up on that little screen on the left? Is that how we're showing up? Oh, that's not gonna work. Haha.
Oh,
We can't. There's no physical way for us to get closer. Like,
that's right.
there's no way, guys. No way. Like, we're already hip to hip, and we cannot get both of us in there. So, either got to scoot the camera system back.
Yeah, can we skip the camera
Or-
back just a little bit?
We'll move the mics now. It's always a technology thing. There's always like man.
Better.
The good news is there's only 4 people on still. There's probably
know
the same
what?
4 people that go every week.
You know what's really funny? You don't know this, but me and all my sisters have like really wide hips.
I wouldn't know
So
that.
every single time we get put in the back seat of a car together,
Uh-huh.
this is how we're
You have to
sitting.
stagger?
So one of us has to go forward and one of us
I
has
just
to
know
go
that because
back.
I'm a humongous guy. So you always have to do that. You can't put me in the backseat
You
of a
just
car
have
with somebody.
shoulders.
That's true.
It's not like you.
Rhonda, I see both of you. That's great.
Hey!
Because apparently some people don't. They just see the middle of us through nowhere. So,
Rhonda, I freaking love Rhonda.
all
I
right,
really do.
let's talk about
What comes after surgery?
what comes after surgery. So they've come to the office, they've had their consultation, they've had surgery now, but there's some follow-up appointments. So
Yep.
the very first appointment after surgery is what?
They're 24-hour post-op. But to be fair, we call it a 24-hour post-op because it happens within 24 hours of your surgery.
It's not really 24
It's not
hours,
24 hours. Yeah.
but it's the next
usually-
day.
Yeah, just the next morning.
Now we do it next day in Las Vegas, but
Correct.
not every provider does it the next day.
Correct.
So we are
We've
pretty,
had some that we've done like a few days later.
yeah.
but
So
for the most part, the
it's
next
not
morning.
imperative that it happens within 24 hours. The whole point of the 24-hour post-op appointment is to check your bite. Because when you're asleep and I move your jaw and I try to put it where it goes, I can get it pretty close, but I can't get it exact. It's really difficult to put it exactly where it goes because I need your jaw muscles. I need you to close your own mouth. So you're asleep, we put your teeth together and go, that looks pretty good. Sometimes I'll make some adjustments this week.
I was say that happened this week where we made some adjustments and we both were like, okay, I will, we'll look at it tomorrow. And then she came in and she's like, yeah, no, my teeth feel great.
That was pretty good.
Actually, that's great.
Yeah.
So yeah, you can put their jaw close, but it's never
exact
what their jaw actually does.
True.
So,
okay.
Yeah.
So 24-hour appointment.
You come in. Obviously you're gonna have Daisy and Amelia say hi and all that good stuff. They kind of ask you some questions up front just so that I know before I come out and get you how you're doing.
Yeah.
So I'll tell you, they're kind of doing some research for me before I get up there.
But let's stop right there.
Yeah.
Okay. 90%. No, I'm going to have you say the percentage.
Oh, it's more than 90%.
What percent of people come in the day after surgery happy?
I would say 95% of the
I agree
time.
with you.
Yeah, patients come in. They
bring us cookies.
They bring
we have
us
patients
treats.
dance on their way in the door the day after surgery.
Yeah, they feel pretty good the day after surgery.
Most patients feel really good the day after.
Yeah.
Okay.
Probably our most common thing that we hear is, oh yeah, I didn't sleep very much after I got home, or I slept clear until my alarm this morning. It's one or the other. It's never like, oh yeah, I slept okay off and on. Like it was like I went to sleep or I was up all night.
So people come in, they're usually feeling pretty good. They're feeling rested. And we are aware you had a major surgery yesterday. So this is not an extensive dental appointment.
No, we take a couple x-rays.
Yep.
Really.
Why do we take x-rays day after?
Obviously for the record purposes,
Yeah.
But we both have this morbid curiosity to see, hey, where did those implants are perfectly planned. I want to see that they were perfectly placed.
I can't take your x-ray with you asleep.
We've tried.
You can in certain ways take it, but the type that I want in the CT machine,
you have to hold super still.
You'd rather be awake for that. So I'd love to just take the x-ray right there and know that everything was where it was supposed to go. But it's a confirmation and verification of the implant placement. Okay, so we took the x-rays. Is that painful to have the x-rays taken the day after surgery?
No. I think everyone is always worried about those little tiny ones that go in your mouth. I can count on one hand how many times I've had to take those x-rays since moving to full mouth.
Yeah, we don't do those.
We just don't do those. We always do the panoramic x-ray and the CT.
So there's no little thing in your mouth that's painful or you have to bite on it and do that whole weird thing.
And I hate taking those as much as you hate having them taken.
So you do hate that.
I do.
Okay, so they had their x-rays. They go into the room.
Yes.
And it's in the same room they've been in before.
Yeah.
So it should all look familiar. And the most important thing at this appointment is, well, what's the first thing we do?
Well, you just look first.
Just look.
Just make sure everything's.
Let's just make sure everything's all right from the day before.
Yep.
And then we tighten down the screws. And I get asked all the time, why do we have to tighten down the screws again? You want me to answer? Or do you want to answer it?
Well, there's a couple of different reasons, but mostly it's because they didn't get all the way to the correct torque the day of surgery. So you go just a little bit further the day after surgery.
Yeah. So the plastic is plastic. It has a little bit of thermodynamic flex to it.
A little bit of give.
A little bit of give. So we put the screws in the day of surgery, and then the next day we just check them all. And almost every time we get about a quarter of a turn tighter on each screw. Yeah. So we just tighten down each little screw all the way around the mouth, make sure they're all good and snug. Now that the bridges are tight, we're confident they're in the right place. What do we do next?
And with the tightening down, it's the little tiny baby torque wrench.
Oh yeah, good point.
That you're going to get used to seeing and hearing over your treatment.
Yeah. Makes little clicky sounds.
Little clicks. Click. Yeah, little tiny click noises. After we get everything tightened down, that's when you're going to start checking the bite.
Yeah. And how do we check? Oh, actually, this is a really exciting topic. I'm actually really excited about this. I don't want to get lost in the weeds, and we're losing people faster than we're gaining them. There's only 3 people watching.
That's okay. People watch it later.
Last time when we had like 25 people. So I feel my feelings are hurt.
Your feelings don't need to be hurt. We'll still record it. We'll put it on the thing.
Don't leave, Rhonda. You're one of only a few that are watching. Okay, so the bite. How do we check bites?
So currently we use regular articulating paper, which is a blue paper that's got a kind of dye on it that will mark where you're hitting when you bite down and grind your teeth.
Yeah. So if you've been into the dentist and had a crown or had a filling done, and they put that little thing in your mouth and go tap, 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 grind. That's what it is. It's just marking your teeth where they're a little bit too high. So we check your teeth and we just start to make little adjustments based on where they need to be adjusted. So that little paper kind of tells us where to adjust. Oh, there's Mia Huff.
Hey, Mia.
Okay. So they're making little adjustments. Is it painful?
No. So that's what's kind of crazy is your teeth are now plastic. So you still have to hear the handpiece,
Right.
but there's no pain associated with it. Our patient this week has a really
Hi, Jennifer.
hey Jennifer, she has a really dental phobia, especially where
water.
like water is concerned. And if you've ever had a filling or a crown, you know there's tons of water in your
It's
mouth.
like you're drowning.
Guess what? Your teeth are plastic. We don't have to use water.
Yeah. So yesterday she was so worried about water.
Yeah.
We didn't even use water. We just adjusted her teeth and she's totally fine.
We rinsed her mouth out like twice and she was like, okay.
Yeah.
I'm like, yep, we're good. We're good.
So no pain tightening down the screws.
No.
No pain
Adjusting the bite.
Mm-hmm. And we get their bite adjusted. And then what else do we have to do during this 24-hour appointment?
Go over the post-op.
That's it.
Yeah, go over the post-op, just the instructions that you've heard a million times. He just reviews them with you.
Mm-hmm. So we're just clearing you for a soft food diet because the night of surgery, you've been on liquid only. So liquid only is mashed potatoes, applesauce, Jello.
I kind of stopped
protein
saying
shakes.
Liquid only, and I said you're on a non-chewing diet.
Yeah, that's a good way to say
because
that.
like Jello, pudding, yogurt.
I just don't want you to chew.
Stuff, mashed potatoes.
You can eat stuff. I just don't want you to chew
Squish
until I see your teeth again. And it's all because, remember, I got your teeth close, but they may not be exact.
Yes.
I don't want you to try to chew and we'll be biting on one tooth or one place that could cause a problem. So that's why I'm on a liquid only diet.
And when you say that you're going to get their teeth balanced.
Yes.
What do you mean by balance?
Good point. I say that a lot. So balanced means when you bite your teeth together, I want you to hit, we both do it. I want you to hit on both sides. I want you to be able to get both sides to close. If you think about the way a bite works, people's teeth don't just come together and hit all the way around at the exact same time. You will always have a tooth or a place that touches first. You will always have a side that you prefer chewing on and a side that feels like it comes together better. That's normal.
And that's natural teeth or full mouth restoration. It's
either one.
Any patient.
But I want you to have, when you bite together, to have contact on both sides.
Yes.
I started smiling because
Bailey came over and
Bailey just walked in and start smiling. I get RBF, I guess. She's been telling me that.
I think we both do.
Yeah. All right. I'm super excited. So smiling. Okay. So we adjust your bite. I get it balanced on both sides. Once the bite's balanced, we talk about your post-operative instructions. And now most patients of ours, because at least 50% of our patients, if not more.
I think it's more like 60% at this point.
We should track it.
So many
again.
of our patients. I have a spreadsheet. I just haven't.
They fly in to see us. They're not from Las Vegas. So most patients that day, so they had surgery. Let's say surgery was Wednesday.
Yes.
Thursday, you come in for your post-op appointment, and most people fly home on Thursday.
Yeah, get on an airplane.
And I don't see you now for 3 or 4 months.
Yeah.
Why do I like people to fly home that day? It's a trick question.
You're feeling pretty good the day after
great.
surgery. You got lots of really awesome medications in your
Yes,
IV.
you do.
Yeah, the inflammation hasn't set in.
But there might be a storm coming.
Yeah, get home and recover in your own bed, in your own home. Whitney.
Oh, somebody just said it's only on Instagram where y'all are closer to the camera and people can't see you very well. Facebook, I can see both of you just fine.
All right, everyone.
Well, there you go. Go to Facebook. I'm supposed to tell you. We can't get any closer. Like this is as close as we're getting. So, but thanks. Now we know. Thanks for the feedback. Okay, so today, the day after surgery, you feel really good.
Yeah.
But as inflammation increases, normal body response, so does the pain. So I tell patients what day is the worst day.
Sunday.
I do surgery Wednesday. Sunday's the worst.
Saturday.
Fly home today. You're feeling pretty good. Just get home and recover at your own house in your own bed with your own stuff.
Yeah.
So yeah, I prefer to go home.
Yeah. A lot of our local patients, even then we don't, because they have your personal cell phone number. If there is a question,
That's a good point.
You do lots of call,
telemedicine.
Text. Yeah. Send me a picture of that, that kind of a thing. So even our patients who are local, we have a patient that lives 5 minutes from the office, and
So every patient, that's a good point to bring that up, leaves a few days before surgery. They get my personal cell phone number.
Yes.
And it's okay to use it. Call me, talk to me, text me, but most stuff we can deal with over the phone or text messages or pictures and kind of work our way through it. Yeah. So you had surgery, you've now had your post-op appointment. And the reality is I do not see most patients now again for 3 to 4 months. Let's talk about the 3 to 4 month thing. I think this is worth exploring. You will hear me say in a lot of previous videos, Tuesday's my day.
Way to go. That's awesome, Joseph. Congrats. Best decision you've ever made, I promise.
Yeah.
Awesome.
So people say all the time, do I heal for 3 months? Do I heal for 4 months? What does that look like?
Yeah.
For a long time, the common belief was it takes 3 months to heal.
Yes.
And as long as we're doing things supported by research, then we can always make adjustments in our decisions. So you'll find my old videos, I talk about 3 months, but there's a push right now that maybe 4 months could be better healing for patients.
Correct.
So I can tell you that right now we're making that decision on a case-by-case basis.
Yes.
And it all depends on how good of torque all the implants have when I deliver them.
Which basically means when he's putting the implant in, how tight does it go into the
we
bone?
measure how much force it took to put that implant in so that we know how well it's down inside the bone. So if we tell you, hey, it's going to take about 3 months before your next appointment. But the reason I want to bring it up in this way is, let's say we have you come back in 3 months for your post-op appointment. You're not going to be in your finals for about 3.5 months at the quickest. It usually
very quick.
Usually really is a full 4 months of healing.
Months, yeah.
So if I tell you that your post-op appointment for healing is going to be 4 months, by the time you're in your finals, you're looking at 5 months.
Yeah.
So I always tell patients, plan on this taking 6 months, and then you won't be sad when it does. But it can happen as quick as 4 months. Does that sound?
But also, I think patients kind of get hung up on that sometimes.
Yes.
But this is going to last the rest of your life if you maintain it the way that we tell you to. So who cares if it's 3 months? Who cares if it's 4 months? Who cares if it's 6 months?
You've been in pain for years and dealing with this for years. What's an extra couple days?
Yeah,
right?
I think we've delivered quite a few finals the last couple of months. And it's interesting. Most of those were on what you would call a normal 3-4 month healing. But we have some that, we have a patient that we're putting into finals almost a year to the day after her surgery.
That's wild.
And so
everybody's journey is a little bit different, but for our conversation today, we're going to assume that it is a 3 or 4 month healing time.
Yep.
So the patient gets on a plane, they fly home, or they drive home in Las Vegas or wherever. And then I don't need to see you back for 3 to 4 months. Now, will I see you back? Of course. So there's something weird happening or something going on, we'll see you. It's not like we don't want to see you.
And there's the occasional patient that you want to have an x-ray on.
That's true. Sometimes I'll want to take another image later.
Yeah.
But for the vast majority, I don't see you back for 3 or 4 months. Okay, so now let's talk about the 3 or 4 month appointment. So
that's a fun appointment.
Right? This is where, the fun stuff starts to happen. Your smile is going to start coming together.
Yes.
So for people just joining us right now, we are 3-on-6 office
in Las Vegas.
In Las Vegas. I'm Dr. Emmett. This is Tiffany. If you've seen any of our videos or any of our stuff, you'll see lots of our faces. Sorry. And so we're talking today about 3-on-6 and the post-op appointments. So it's also an open forum to ask your questions. And you'll notice a few people have made comments in the chat, which thank you so much. We love the interaction.
Yes.
But also, if you have a question, even if it's not on topic, ask it. If it doesn't make sense to address right now, I'll get to it by the end of the call today. Yeah. So, all right. Let's go now to the
their healing check appointment. 3 to 4 months. Yes.
Okay. They walk in the door and we have to take x-rays. Why?
To verify that everything still looks good.
Yeah.
X-rays are a great way to know if there's anything nefarious happening.
I love that word, nefarious.
Yeah, nefarious. But even then, an x-ray doesn't tell the whole story. So we've definitely had some that were like, that x-ray looks perfect. And the patient's like, this one feels interesting. We're like, okay. But so x-rays first. And again, it's just records.
But we're just checking on the implant health. There's a lot of different ways to do that, but the x-ray tells a part of the story.
Yes.
Sometimes I can look at an x-ray and say, uh-oh, that implant's not okay. Or sometimes I look at an x-ray and I'm like, everything looks great. And then we do another series of tests and go, uh-oh, maybe that one implant's not okay. So let's just get hung up on this for a second.
Yes.
Okay. What is my failure rate for implants?
2.15.
So 2.15% of the time an implant fails. And I tell people all the time, the best implant, the best bone, the best patient, the best surgeon, the best everything.
Everything you can have.
Implants can still fail. Depending on which textbook you read, that could be between 8 and 15% of implants fail. So implants can fail, and where we would catch it is at this appointment.
At that 3 to 4 month healing check. Yes.
Is a failed implant typically painful?
No, that's what's interesting. Patients are anticipating it being really painful, and then we're like,
they'll come in and they'll have a failed implant and not even know it. Most of the time, that's what happens.
Yes.
They didn't come in saying, "Oh my gosh, I'm having a problem." They're like, they're sneaky. They fail and they don't even know they failed. The way we find out is through a series of tests when I can say, hey, I think this implant has failed. let's go worst case scenario. I don't like to dwell on that land because it's less than 2.15% of the time.
Yes.
But worst case scenario, you come in for your 3 to 4 month appointment and an implant has failed. Number one, we got to get the implant fixed. Most of the time, that just means take it out.
Depends on where it is.
Yeah, depends on where. Is it the very back implant? I might put a new implant in that day, just right in front of it. Does it mean that we've totally stalled your treatment? No. Depending on which implant, sometimes we just keep progressing right on through.
Sometimes it's just a brief pause.
Yeah. Yep. Or we pause and we add a couple of months for that implant to heal. So either way, having an implant failure is not the end of the world, but that's the appointment where we'd find it. And we're going to do our best to address it right now. Yes. We want to fix it, whatever's happening right now. Okay. So we've taken the x-rays. Everything looks good. Next step is we take your teeth out. Yeah, we take your temporary to test the implants. That feels weird. So we're going to talk about taking teeth out, and then we're going to address all these questions because I've seen them pile up. Oh yeah, there's a okay. So we took the teeth. How do we take the teeth out? You're kind of a Lego piece at this point, so we literally just undo the little screws and take the temporaries out. A lot of our patients do really, really great home care. And your bridges and gums have adhered to each other, which is awesome. Good problem. Great thing to have. That's a great problem to have. Kind of uncomfy to have the bridges come out sometimes. Yeah, it can be a little, we call it a little pinch. Yeah, I don't numb people for it. They're not getting numb. Oh, no, it's not that. Yeah. But it feels very strange for you to not have teeth in. We try to work as quickly as we can during this appointment. I can't imagine what it would be like to not have my teeth in. We don't let other people come in the room. Like we had one patient whose husband's like, "Oh, I'll come back." I'm like, "No, you won't." No, she's like, "No, I don't want anybody to see me like this." Won't. So they stay out in the waiting room, and we work as quickly as we can so that we can get your temporaries back in, kind of restore that feeling again. Yeah. So if you had teeth before surgery, this would be the first time you would feel what it feels like to not have any teeth in your mouth. And so I just tell people it's weird. It just feels really strange. Very, very strange. But we take the teeth out. We clean the bridges, and then we test all the implants. So how do we test implants? The first one, I give them a love tap. I always call it that, but I tap on it. It's a percussion test. Yeah. With the back of his mirror. Yeah. He's not like. That's not a hammer. Yeah. Just got a little mirror and just a little. A healthy, happy implant makes a very specific sound. And it's called a percussion test. Really sad implant makes a very specific sound. Yes. If you get this real hollow thud, like just a empty space, that's not a happy implant. Happy implants say tink, 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 really solid sound all the way across. So we've tested all the implants. All the implants are perfectly great. Sweet. Now it's your turn. What are you going to do with the patient? Oh wait, no, I said we'd address questions. Well, you also torque the abutments. Oh yeah. So then we just test every little abutment real quick and make sure the abutments are at the right height or tightness. Yes. And then also by doing this, that's a little test on the implant again, because now we've put some rotational torque on the implant. And if an implant's going to fail and I put some rotational torque on it, that can elicit an uncomfortable feeling. So I'm watching your eyes and going real slow when I test all the implants, because that's, if I haven't caught it on the x-ray and I haven't caught it on the percussion test, I'm most likely going to catch it now when I'm checking all the implants for torque. And I think it's important. Some of our patients, we had someone come in the other day and they were expecting our waiting room to be really full. Yeah. And at least at our office in Vegas, we see one patient at a time. Yeah. So there's no reason for him to hurry through this process. It's scary to go in, make sure all your implants are good, especially if you have some dental phobia, which a lot of our patients do. Good point. So we work slow for this part. We're not going very methodical. Yeah. Or if there's anything that's uncomfy, you're fine, just tough through it. Like, nope, that sentence has never come out of his mouth. So yes, it has. You're fine. Sit down and be quiet. No. If you're one of his patients, you know it happened. We're really careful. Yeah, very, very careful. Okay, let's take some questions real quick. Okay, Robin, I have a severe overbite. I need my molars longer to correct right to hit or jaw surgery. Can you correct my bite with this? I prefer to do the all on four with the jaw being Sure, she meant grinded down. It says grinded. Grinned. Oh, it does say grinned. Grinned down. That's all right. Over here. Don't worry. I don't worry. I'm not calling you out for spelling. Okay. I have had a consultation telling me they can do the all on four because the bite versus jaw surgery and ortho. Yeah. So, Robin, it sounds like your situation is pretty complex. Do we correct overbites all the time in 3-on-6? All the time. Absolutely. If you are a candidate for an all on X, I strongly encourage you from my heart to yours to go see your nearest 3-on-6 provider.
Yeah.
If you can have a 3-on-6 prosthetic, your experience of this prosthetic will be superior long-term. I promise you. Now, some patients can't have that, but we do correct overbites all the time. Now, when you say severe, sometimes that means different things to different people. A severe overbite may require jaw surgery to correct it.
Yeah.
Patients sometimes think they have a large problem or a big problem,
Right.
and they come to see us and it's a mild problem.
Yeah.
It's not that big a deal. But if we're going to assume that your word severe is correct, the only way to get the answer for that is to go see your 3-on-6 provider.
Have some x-rays taken,
Yeah.
see where the bone actually is. And because people think, oh, my teeth are right here, so my bone's right here. It's not the case.
Not always the case. A lot of times teeth are pushed
Coming
out to the top
Mhm.
or forward on the top, and we can correct those and bring them back this way.
Just by putting the implants in a different angle.
Push your bottom teeth forward on the jawbone, so we can correct a very large overbite with.
You have corrected.
Oh yeah,
quite
we
a
correct them
few.
all the
Yeah,
time.
I've corrected quite a few
So is this
deep
solvable
overbites.
without having some sort of a jaw reconstruction? Potentially, yes. Of course, we'd love to see you in Las Vegas, but
Mhm.
I always encourage patients, go find your nearest 3-on-6 provider, because if you're going to end up with full mouth restoration, it should be 3-on-6.
And, flights to Vegas are really
Yeah,
cheap.
I love to see you. Like, I'm not pushing away, Rhonda, or Robin, but yeah, we correct those all the time.
Yeah.
Very normal thing for us to do. And I prefer to do less bone removal. So if we have to make some tall molars, okay, but I don't want to grind down your bone. I prefer not to do that. So there's oftentimes a lot of things we can do to avoid removing healthy tissue, healthy bone.
Well, plus you were just talking about an implant failure. If you removed all the bone and you have an implant failure,
Now where?
there's no bone to put a new implant.
Yeah. So it's really smart to be conservative with surgery.
Yes.
Okay. If there's time, can you talk through the uncovering process? My top arch is 3-on-6, Dr. Osmond in Tampa. We love Dr.
We love Dr.
Osmond.
Osmond. Yeah, he's cool.
And I had 3 implants on my own back bottom. I have my uncovering appointment for my bottom implant soon, and wondering what to expect.
Yeah.
You start.
Uncovering's pretty simple at our office. I would assume it's pretty similar to Dr. Osmond's process.
We just take a hammer.
Yeah, and just no.
I want to throw Osmond under the bus so hard right now somehow.
No, Osmond's awesome. No, the uncovering process, you do have to get numb. However, it is not numb like you were after surgery. It's not numb like
it's not numb like I'm going to take a tooth out.
No, it's the very, very
just
top of the gums that's over the top of that implant.
And then how do we uncover it? How do I know where the implant is?
Well, you have to look at x-rays.
Yeah, we have to find it.
Have to look at x-rays. Sometimes you can just take an instrument after you're numb and you just kind of poke along the top of the gum. And when it doesn't go into the gums anymore, it's because you're on top of the implant.
Yeah.
So make a tiny little incision.
There's 2 ways to make the incisions.
Yeah.
In my practice, I just make an incision.
Yeah.
But they make these little instruments that are perfectly circular.
Oh, yeah, the little punches.
Little hole punch right down on top of the implant.
Yeah.
Once that little hole punch is done, we just take the cover off of the implant and put the abutment onto the implant. Yep. So that should be, they're relatively simple.
We don't even schedule extra time for those.
Fast.
When we have a patient's coming in for their healing check appointment that needs an uncovering, we don't even schedule extra time because it's usually.
Plus, Dr. Osmond's a wizard.
Yeah,
so
he's a wizard.
You'll be great. Yeah. You're in good hands. But yeah, that should be a pretty easy appointment.
Yeah.
And you get numb for it, so you shouldn't be in a lot of discomfort.
Yeah.
Good question.
And tiny numbing.
Yeah, tiny amounts. A little bit. Angela asked, I'm on day 2 after surgery. Congratulations.
That's awesome. Yeah.
I feel like everything is so big in my mouth, especially a couple of the teeth, but especially one on one side. Is that normal? Here's the thing. Normal for every patient is different.
Very different.
So if that's what you're experiencing, guess what? That's normal. I know it's probably not the answer you're looking for 2 days after surgery, but I don't know what your precondition was. So a lot of times we'll have a patient that didn't have any teeth on their left side.
Yes.
And we give them teeth and they come back in a week later, they call or they send me a text. They're like, oh my gosh.
I have so much happening on this side.
Like, what's going on? Like there's so many teeth or so much teeth in my mouth, but they didn't have teeth for a long time. And so it can feel a lot like that. But keep in mind that right now you're just in your healing set of temporaries. So my best advice to you is to get comfortable. It will start to feel better and better every single day. Your mouth has a ton of inflammation right now. You just had a major surgery. Give it a couple of weeks and trust the process. Let that swelling go down, the inflammation go down, and then see how they feel. But also keep in mind that in a couple of months, you're getting a new set of teeth. And that's where we can make all the cosmetic adjustments. We can make your teeth fit and feel a lot better than they currently are feeling to you right now. But you're only 2 days out. So if you were my own patient, you called and said, hey, it's 2 days out, my teeth feel big or they feel taking up a lot of space, I'd say, okay, that's going to be normal for you. And your soft tissue, your muscles, all the stuff in your mouth learns really fast. So it's going to start to feel better really quickly.
Well, I think you're starting into inflammation.
Yeah, so that's the other thing. It's just
you're starting.
There's a storm coming. I'm sorry, but over the next few days, it might get worse.
So if everything feels big in your mouth right now, okay,
okay, you're only 2 days out. So be patient, trust the process, but.
And ice packs are your friends.
And ice packs, lots of ice packs.
Lots of ice packs. Okay.
Thank you. Love Dr. Osmond. Definite wizard.
Definite wizard. Yes.
And also you guys. Thanks. Life changers. Appreciate it.
Lindsay.
Love that. Joseph, what makes you guys go from silver to gold to platinum providers? Is that the amount of surgeries? And what is that number? And how many shades are okay? Wow.
Let's start with the first one.
How many platinum providers are there in the country right now?
Okay.
That's a trick question. I shouldn't have asked it that way.
Hold on. There's Dr. Roberts. There's Dr. Locke. There's Dr. Maxwell. There's Dr. Fairchild. There's Dr. Emmett. There's Dr. Shore. There's Dr. Osmond. 7
platinum providers.
I look at the website a lot. Apparently.
So, platinum providers, bottom line is we just do a lot.
Yeah.
So there's a lot of offices and a lot of very talented doctors that may not be, they may be a bronze or a silver or a gold or whatever they are.
Whatever it is,
and they might be wonderful, but they just don't do a lot.
He just corrected me and said 6.
Oh, there's okay.
I gave someone platinum status that didn't.
We have very strong.
Thank you, Whitney.
Confirmation. There's 6 platinum providers.
There you go.
It's just offices that do a lot. And at my office, this is all we do. If you called me tomorrow, don't call me tomorrow, it's Saturday. If you called my office on Monday and said, hey, I want a single implant, what do we tell them?
We refer them to a different office. We don't do a single implant.
We can't do that.
Yeah.
We cannot do a single implant.
You can do
I can do it. We don't have time in the schedule.
We don't have time to schedule them. We're so busy doing 3 on 6.
Yeah, we don't do fillings. We don't do crowns. I don't do anything else besides 3 on 6, period. So we just do a lot of them. Next part of this question.
I don't know what the number, I actually don't know what the number is. I just know that it's a lot.
I mean, we do 8 to 10 arches a month.
Yeah.
So that's a lot. Okay. How many shades are there? Cool. In plastic teeth. We were going to talk about this today.
We're actually going to talk about
Daisy
this.
wanted us to make sure to cover it. So in plastic teeth, how many shades are there in plastic teeth?
It depends on the office, first of all, because I know
hold on. The company only makes 5 shades.
Yeah, I was going to say, I know some offices offer all 5 shades.
Why do we not offer all 5 shades?
Because some of them are super dark.
Or they're white like this plastic thing that's sitting on this desk.
Or they're white like a toilet bowl.
So I don't even offer patients the super dark ones or the super bright white ones. Now I have 2 or 3 patients total we've put in the bright white ones.
Yeah.
Out of all fairness, I do. But generally, there's only a handful of shades available in plastic anyway. And I really, 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 really like shade B1. Yeah. In plastic, it looks nice. It looks good. Nobody's going to look at your face and be like, whoa, where'd you get those crazy bright teeth from? They look appropriate. I really like shade B1.
Yes.
So in my office,
B1 is a nice organic white color. Ooh. We like that word.
A patient used that.
We have a patient that's like, I want organic white, and I was like, oh, I'm stealing that.
Yeah. So
organic white.
And how many shades are they when I get to my finals? Unlimited.
Oh yeah, there's a ton.
So in your zirconia finals, we can do lots of tricky stuff. Just know that there's like probably 5 or 6 common shades that are chosen for finals. It all depends on how the office does that and what they want to offer to you. But just know that in your finals, there's lots of choices. Yeah. I have a patient right now in like C4 finals, which is dark,
super dark.
But he said, I don't want my teeth to look, I want them to look like they look now. I don't want people to know.
Yeah.
And then I put his teeth in his mouth and he goes, all right, doc, I need a chip in this tooth right here. I was like, are you kidding me? He's like, no, here's a picture. I want a chip in my tooth. I took a handpiece out and took a chunk out of his tooth and he goes, that's perfect. Just how I wanted it.
I left the room. I was like, I'm not watching you do this.
So
perfect.
So lots of shades, lots of flexibility, lots of colors. I was offered 2 colors for my healing teeth. Oh, I should have read further.
Really white and somewhat yellow. Yep. That's
pretty normal.
Yeah,
because between those 2, the other thing is plastic will stain.
Yes.
So over the course of your healing, if you're going to wear these things for 3 or 4 months, you're going to get some staining and discoloration. So that's why I put people a little bit brighter and then they kind of stain down a little bit. But yeah, that's normal to be offered a couple of shades for your consultation.
Yeah.
Cool. For full mouth 306, what is your pricing? And if I can send you a 3D x-ray, can you access, if possible, correct the bite? Oh, Robin from before.
Oh, yeah.
Robin, call my office on Monday, 702-710-9006.
Yes.
Call the office.
They'll go over all of that with you, all the pricing.
Well,
all
I don't want to act like we're skipping it. We have lots of videos about pricing.
Oh, yeah.
But just plan on, I tell people all the time, the price starts at $55,000 and goes down from there.
And in our office is an all-inclusive price.
Yeah,
So
that
that's
includes
everything
sedation,
start to finish.
your entire recovery package. We have tons of videos
Yes.
about that. I don't want to hide that information from
No.
anybody or feel like we're
It's not a
skirting
secret
around
for
it.
our office, yeah.
I tell people, plan on it being 50 grand.
Yep.
And then you won't be surprised either way. If you need some extra stuff, then it's a little bit more, but not everybody needs that extra stuff. They don't need sinus lifts and things. So it could easily be a little bit less.
Yes.
So plan on 50 grand.
Yes.
Let's see. Yes. So that's, yeah, sometimes I can open your 3D x-ray.
Yeah.
Depends on what system they used.
There's a lot of systems, and it depends
Most
on
of
like
these
how
computer
they
programs
saved
don't
it
play
and-
together very well.
Yeah.
But we can definitely make some headway. So I'd love to get on the phone with you and talk to you about it. Okay. Yes, that's what it feels like. I'm trusting the process. Just feels super weird. I saw Dr. Stanley.
Hey, nice. We love
Dr. Stanley was on my live event
Yeah,
2 weeks,
we love Dr.
3
Stanley.
weeks ago, whenever it was. Dr. Stanley's great. You're in great hands. Trust the process. So you're doing the right thing.
Yep.
Might be 7. Double checking now. Haha. Hi, y'all.
Whitney
Thank you.
says Tiffany is right.
7 platinum providers. Here, I'll give you a high five. High five to that.
And I named them.
Yeah, that was really good.
I
Right
feel
off
like
your
I should
head.
get. I feel like the corporate office should be sending me a new jacket.
They are sending you a new jacket.
I know, but I just wanted to make sure
Oh,
they're
right.
sending.
Okay,
For
so
knowing all the platinum providers, I feel like I should have a
7
parade in my
platinum
honor and a
providers.
new jacket.
okay, so
Judy
we're
says
gonna
hi,
go
y'all.
back.
Hi, Judy.
Hi, Judy. We're gonna go back now and talk about the 3-month appointment,
Yep.
and then we'll come back and answer questions again. So ask more questions. Happy to go over those.
So
Okay.
we checked all the implants.
All the
Everybody's
implants are
and
healthy.
Yes.
Now what do you do? Because the teeth are off. So
Yes.
what do they see in their mouth right now? If they want to see.
I don't usually let you see.
Yeah, most
Just to be
people don't want
fair, some people will say, "Oh, I want to see. Can I have a mirror?" And I was like, "Are you sure?" I always ask, "Are you sure?" Because it
Can be alarming.
can be a little alarming. Your gums have these beautiful little scallop
gums are
look
beautiful.
to them, and you can see the little top of the implant, the little abutment, but some patients they don't want to see that.
I can think of one particular. I can't see her name right now, but she
No,
was like kind of
absolutely not.
freaking out when we
She
took her teeth out.
actually-
She's very young.
She actually saw her mouth in the reflection of my safety
that's
glasses,
right.
and
It's like,
it
"Oh, no.
freaked
Oh,
her
my
out a
gosh.
little bit. So
I can totally
yes.
see it. Yeah.
Yeah. So I encourage you, if you're fine with that kind of stuff, I'll show you all day long. But I kind of encourage you not to.
You don't need to.
You don't need to. So now I'm going to do a bunch of scans. We did these exact same scans during your surgery while you were asleep.
Not the exact same because you're putting a.
I do.
Oh, well, they're asleep. I'm sorry.
Yeah, while they're asleep. I was like, no, while
I
they're
thought
asleep.
we were just going to say
No,
while they're
so,
at their appointment.
While you're asleep, I wanted no part of that. Yes, Lindsay. No, just don't do
You
it.
don't have to see.
My dad would always say, no one wants to know how the sausage is made. Just don't look. It's just better not to look. But yeah, so I do the exact same. You know my dad. Is that not so typical of what my dad would
That's why I
say?
started laughing.
So yeah, we do a bunch of scans
Okay.
that's going to tell the computer and the lab where your implants are, what the angulation is, what your soft tissue looks like now. We did those exact same scans while you were asleep,
Right.
but obviously you were asleep, so you don't have any memory of that and all that good stuff.
And now all the healing's happened.
all the heat. Yep,
So we
all your
just
soft
want
tissue's
new
done,
scans of where
healing.
all your soft tissue
Yes.
is. Because oftentimes there's gaps now between your gums and the teeth.
Yes.
That's normal.
As they've healed, they've settled
And
into where they're
we're
supposed
going
to
to
be.
close all that off.
Yes. So I start on the bottom, do those scans
Okay.
with the same little guys up top. Do the
They
scan.
look like a little checker or
Yeah, little dominoes.
little
piece.
dice.
Yeah, little dice. They're super cute.
Yeah.
But I can.
There's a fuzz floating. I got it.
I can do those scans for most patients in about 4 minutes.
Yeah, it's fast.
Luckily for me, I have Amelia there to flip the computer for me from your lower to your upper and put all the information in. But so when I say I try to go as fast as possible during that point, I really do, because I don't want you to be without your teeth any longer than you have to.
Yeah, we want to get the teeth back in.
And
And
those scans are quick.
so you just took out the teeth and they're getting cleaned,
Yes.
but you're going to put those exact same teeth back in my mouth?
Yes.
Why?
Because we have to make all the cosmetic changes.
You don't have your other teeth yet.
Yeah, we don't have your teeth yet.
So you're just getting your current set put back in your mouth.
And it's kind of funny because patients always say, "Oh, these feel better." Yeah,
They're clean.
They're clean. They're super
That's
clean.
about it.
Yeah, they're super clean. So we put those back in your mouth.
But also, what's the other reason why we want to do this efficiently quick? Once we take the
your
bridges
soft
out, and we
tissue.
want to get them right back in.
Yeah, so soft tissue is kind of like a rubber band.
Mhm.
So if you have tension on a rubber band, it's where it's supposed to be, right? But as soon as you release that tension, the rubber band goes back to its original shape. So does soft tissue. So your
So
gums.
right now, the soft tissue is
They're
being
pushed
held
out.
out like this.
And then we take them out.
They start to close. So if that's off for 30 minutes or an hour, when we put the bridge back on, it'll push the soft tissue out and it can get this little pinch.
Yeah.
And some people's soft tissue is more robust, springy than other people's. We'll take the bridge off, and like 3 minutes later, we're putting it back on, like, ooh, that's pinching quite a bit.
And if I notice that when we take the bridges off, if I see one that I'm like, what are you doing?
Yeah.
Stop it. I'll actually put one of the little scan bodies on to hold the soft tissue out of the way, even if I'm not.
That's
so I did that.
That's because you're nice.
That's because I'm really nice.
You're
And
really aware.
I don't like the dentist either. I like him, but I don't like the
the heck?
dentist either.
There's
So
a whole
I try
TikTok
really
thing about
hard.
that, about dentists who are like, everybody that meets, I don't like you.
Yeah.
Guys, that hurts our
When
feelings.
you walk in, you're like, I hate you. Yeah.
Deep inside here.
I don't ever say that.
You're
I just don't like being at the dentist.
Okay, so we derailed. Teeth are out.
Scans
are done. Now we put the
in.
teeth back in.
Yes.
And now what we do is we talk about cosmetic changes.
We do one more scan with your teeth in.
Oh yeah, one more scan. Sorry. I
Yeah,
always skip that at the office.
And
too.
I take some more pictures.
So, okay, so you've done your whole part, scans, pictures,
All the things.
all the things. And now we're just going to talk about changes.
Yeah.
So do we like the height? Do we like the width? Do we like the shape? Do we like the contour? Do we like our canines? Is there something we need to change? Because now's that chance to make cosmetic and functional changes. So by default, what's going to happen no matter what? I'm going to tuck your teeth up into your gums all the way around.
Seal everything off.
Going to fix your bite. Most of you, your bite has been not exactly correct this whole time. I'm going to fix it. And so all this information goes back to the lab, and the lab takes about how long to get us new files?
2-ish weeks.
Call it 2 weeks.
Yeah, usually about 2 weeks.
So
by the time they get us the file and we print
because the next set of teeth is again printed at the office
in plastic
in the same color options that you had originally.
Some patients do change.
Well, that's why I said options, because we could change the color right now, but it's not a big difference.
Most of our patients that chose that bright white,
they change back.
Just so you know, yeah, they go.
If they're begging for white teeth, they're like, how about we go back to a little bit darker, doc? Let's try those.
Yeah.
So you come back and see me in 2 weeks. We take your teeth out again.
Take the first temporaries out, put
the second ones in. Is that painful?
No.
Don't lie.
It's not painful.
Okay.
The same pinches that we've talked about, you can get a little
more of that, because now I'm tucking your teeth further up into your gums a little bit.
In the whole time you've been doing this, I can think of 3 patients that it's been painful.
That's true.
Like to the point that
ow.
It took longer than the normal appointment because they were in a little more discomfort. 90 seconds.
So that's a good question from the gallery, 90 seconds.
Yes.
So I actually had a patient make me a sign that says, Dr. Emmett, 90 seconds.
Yep.
And it's hanging on the wall in this room, because if you're getting a little pinch when I'm putting your bridge back down, it always goes away in 90 seconds.
That's just how long it takes for your gum tissue to just relax back out of the way.
Yep. Take that trigger pressure, push it out, and then it's not as painful. So
90 seconds.
We get your teeth out, we get the second set in, we get them all tightened down. What's a big difference between your last set and this set?
I mean, it's segmented.
So
now you've got actual
with all the
bridges.
same answers.
Yeah. But also what's important is we've kind of started calling these teeth something different at our office. So it's easier for patients to understand. Your first temporaries are healing teeth.
Correct.
They are just for healing.
Healing teeth.
They are not going to be perfect. They're just for healing. Your next temporaries are your cosmetic teeth. Those are your cosmetic try-in teeth. So once I say that to patients, they go, oh.
Makes sense, right?
Cosmetic teeth for your second temporaries. And then make sure that if you're happy with all that, then those are your finals.
Okay.
Move your finals.
So if they healed for 3 months, they came in, it took the lab 2 weeks to get the file back and for them to come back in and have an appointment. Now they're at 3.5 months and they just got their second set of teeth.
Yes.
And they look at them in the mirror and they go, oh my gosh, these are beautiful. They're perfect. I love them. It's everything I ever wanted. I always make them go away for a couple of days and chew and talk and smile. Make sure that they like their teeth, because the next step is we order zirconia. Zirconia bridges will be, if we don't make any changes, an exact duplicate of the second set of temps. But how will they feel to the patient's mouth?
Oh, they feel very, very different. And the reason why he makes you wait a couple of days is because without fail, every time I've ordered finals sitting in that room,
True.
we've gotten a message from a patient. Oh, can we just make this
One little
And I'm like,
adjustment.
I have to get on and message the
Yeah.
labs. Stop! Don't make those. And so
Love
yeah,
hates
someone gets home and they spouse looks at them or they look in the rearview mirror. They're driving. They're like, oh, every time. So you have to have those for a couple of days
Right.
before you approve your finals.
Yeah, before you're ready to
yes, your finals are going to feel very different from your second
go.
temporary.
Mainly because
they're slippery.
so slippery.
Yeah, they feel so good.
Your lip will slide better on your front teeth. Your tongue will touch them better. They're the thinnest they're ever going to be.
Yes.
So every patient that gets a final goes, oh, these feel amazing. They feel like normal teeth.
Usually what happens is we put the first bridge
and
in.
They cheat and they
and
feel
there's
their tongue.
Their tongue's over there just wanting it. And it's like,
yeah, they can always tell.
We're busy.
Okay, so we put their teeth in. They call us 2 days later, like, oh my gosh, this is the best thing ever. Make my finals. It's now 2 weeks for the lab to make finals.
2 weeks for the
That's what the lab needs.
The lab to make them. There's still a little bit of shipping.
Yeah, and then they got to ship them. Then you got to come back to the office. So even if this just went for right to 3 months, it's 4 months till they're in their finals. If you're doing the math on that, you're 4 months to your finals. So you had 4 months of healing time. Okay, so they have their final appointment. How long is the final delivery appointment?
We schedule 2 hours.
Why do we schedule 2 hours?
We schedule 2 hours because in zirconia, there's always little adjustments that have to be made to get them to seat down next to each other. Plastic has flex. So when you put that screw down, if there's two that are really close together,
they kind of just go,
oh, okay.
Snug in.
Zirconia is extremely hard and it doesn't squeak.
No flex, no give.
Flex. It doesn't,
that's just what you get.
It doesn't care. So we delivered finals for a patient yesterday and we put this side in, and we were trying to put this one in and this one was like,
not happening.
Nope. So we took this one out,
made some adjustments, put the other one in.
So it's kind of a puzzle piece with finals because if the zirconia doesn't want to sit next to each other, it's not going to.
So that can take a little bit longer. Plus we take some pictures.
We do some pictures, some scans for your custom night guard at the end. We do the
dance party at the end
at our office.
But
we do the final filling so that there's not the little holes.
Oh yeah, we fill in the screw channels. We haven't talked about screw channels today at all.
Yeah.
But yeah, in your finals, we fill those in permanently so that your tongue can't find them and food can't get stuck in there anymore. So that feels really good. Okay, so we have exactly 6 minutes left. So real quick, anybody watching right now, there's 6 minutes left. They keep telling me to smile. Guys, I have RBF so bad. So there's, if you have a question, now's the time to ask it. So ask your questions right now. Again, I'm Dr. Emmett. We are in Las Vegas. If they wanted to find us and get scheduled for a virtual or in-person consultation, what number should they call, Tiffany?
702-710-9006. You can also go to our website and there's a little form. So it's alloutdental.com. There's a little form that you fill out, hit submit, and we will call you the next business day. You'll talk to Amelia or Daisy. They're wonderful. They're amazing. They can answer all the questions. This is all our office does. So it's not like when you call, we're like, oh, I don't know.
Let's choose the right person that can answer that.
No, there's 4 of us.
We
all have
speak the language all day, every day.
Yes.
We eat, breathe, and sleep 3 on 6. Joseph just asked a question. I was told everything was made in-house. Is that everything made in-house except zirconia finals? Let me just tell you now. If your office has all of the equipment and technology, then everything besides the finals is made in-house.
Yes.
There are some offices who don't have print capabilities. Yes. So not everything is made in-house, but I'd say the vast majority of offices that do a lot of this type of work have the facilities to make at least print your temporaries in-house. Yes. But milling zirconia in-house is not practical most of the time. There are some offices that have mills, super cool.
Massive machines that are required.
Yeah, the amount of work. I'm not a lab tech. I was a lab tech for a long time. I don't want to be a lab tech. You want me doing surgery and fixing smiles, not sitting in the back making teeth. So
when everything was in-house. Everything is in-house. If you go to a licensed 3-on-6 provider, which you did, we know Dr.
She's
Mary.
great.
We were
Mary's
there
great.
when she did her all of her training and stuff. She's wonderful.
Yeah, I helped.
You were one of the ones that was training her.
Yep.
You still are using the 3-on-6 lab that is in Utah.
Yeah,
and that's
Well, that's how
That's
you
who
can know
you
you have an
want.
authentic product.
Yeah, that's
You're
who
actually
you
getting a
want
3-on-6.
So we have a team. Each doctor is has their own team.
Yes.
Our team, I could name them because we work with them all day, every day. But they're the ones that are doing the different design changes and stuff with your doctor. So Dr. Emmett yesterday talked to, man, he talked to everybody yesterday. He
Yeah,
talked to
yesterday as
Mallory,
well.
he talked to Lily, he talked to Hannah, he talked to the other Hannah, he talked to Brooklyn.
Huge shout out to them, by the way. They're
Yeah,
amazing.
yeah.
Everybody at the lab is amazing.
Yeah. So each doctor has their own lab. A lot of these individuals are on multiple doctors' teams. It's always funny when someone new gets added to our team. Jesse,
Like, who is that?
got added to our team this week. I was like, I don't know who that is.
Yeah.
He's fine. We like him. It's
Is it-
great.
Yeah, sorry.
But yeah, so that's how you know you're getting an actual 3-on-6 is you're using the 3-on-6 dental lab that this is what they do. So,
Yeah. So yeah, good question. Joseph, you're very welcome. Thanks for tuning in.
Yeah.
So if somebody is thinking about 3-on-6, if they are thinking about full mouth rehab, the number one piece of advice I can give you is go see your nearest 3-on-6 provider.
Yeah.
Guys, this is all we've done now for many years here in Las Vegas. And I can tell you there's a dramatic difference in the quality of life you will experience with an all-on-X versus a 3-on-6.
Yeah, for sure.
I just barely converted another patient over from all-on-X into a 3-on-6.
Yeah.
They just said it's dramatic how much more room there is in their
So
mouth
different.
and
Yeah.
the methodology that we use for a 3-on-6. So I can promise you that your experience of your prosthetic is superior with a 3-on-6.
Yep.
And this is your mouth. Everything about your life is involved. So
Yeah.
talking, kissing, eating, chewing, everything you would do is with your mouth. And you don't want some big clunky, uncomfortable thing inside your mouth. I promise. You don't want it.
Slurp your spit under.
Last question. We're going to take this last question and then we are done for the day. So Lori said, are both temps 1-piece, then 3-piece zirconia finals? First set of healing teeth, 1-piece, one arch.
Top, 1-piece bottom.
Second set is when we would segment. So if you're going to have 2 or 3 or 4 pieces per arch, it would happen during your second set of temporaries that you'd wear around for a couple of weeks until your finals get in, which are typically segmented. Now, can patients be in finals that are 1-piece? Yes or no?
Yes.
Yes.
Yep.
So everybody's case is different. Don't get hung up on that. Get hung up on having teeth that follow the emergence profile, that fit inside of your gums, not over the top of your gums.
You have your bone.
You keep your bone, you keep your gums.
That's what you're.
But yeah, so yeah, good question. But we start you with 1-piece during healing for that really good stabilization. Then we want to move you into segmented for that good bone stimulation and continued bone turnover.
Yes.
Okay, so we got right down to 30 seconds.
Good
You
job.
guys, thank you so much for chewing
and choosing us.
with choosing us,
Chewing, choosing, and tuning in.
tuning in. That's the
That's
word
how
I
we're
was
gonna
looking
end it
for.
from now
Thank
in.
you.
From now
Chewing
on.
and tuning in.
Choosing, and
So if they want to schedule a consultation, they call
702-710-9006.
That's it for us, guys. See you next time.
Thanks, everyone.
Later.
Woo, woo.
Goodbye.
We had some great questions.
Yeah, I like it when they
Great
ask a lot of questions.
Yeah. I like that.
That's perfect. Let's see. I think I have to hit end stream on my side.
Yes. Yeah. Nah, just keep it going.
No. What's up, guys? We're going to be here all day.
We're going to be here all day.
And